Welcome again to my YouTube channel. Today we are going to talk about diabetes mellitus and also about in the next topic we are gonna say about gestational diabetes. So what diabetes mellitus is? Diabetes mellitus is a chronic metabolic disorders where there is either insulin resistance and autoimmune destruction of pancreatic islet of Langerhans, or there is what we called insulin resistance. So there we have two types of diabetes mellitus. The first type is called type 1 diabetes mellitus. The second type is called type 2 diabetes mellitus. The first type is caused by the autoimmune destruction of pancreatic islet of Langerhans, and the second type is caused by insulin resistance. So in the first type we have autoimmune destruction of pancreatic islet of Langerhans. Pancreas is made up of many tissues tissue types such as acin and the islets and the islet of Langerhans. Acin is made up of digestive juice digested and that pass into the duodenum. And the second is in pancreatic islet of Langerhans. And the pancreatic islet of Langerhans is made up of 4 cells. The first cell is called alpha cells, the second is called beta cells, the third one is called the third one is called delta cells, and the fourth one is called F or PP cells. So alpha cell is made up of glucagon. Sorry, the beta is made up of insulin and the amylin, and then the delta cell is made up of somatostatin, and the F or PP cell is made up of polynucleotides. So the most important islet of Langerhans is the cell types in managing diabetes are alpha and beta. Alpha consists of glucagon, and beta consists of insulin. So what's happened when you say that someone has diabetes mellitus? Suppose you are at the health center or at the hospital, and someone comes to the hospital experiencing fatigue, experiencing blurred vision, and you measure, and she says she has a past history of chronic diabetes, and when you measure blood sugar level using a glucometer, you observed that he or it has a blood glucose level of 215. So what to do the next intervention in this to monitor vital signs, and you see that she has the blood glucose level of 215, milligram per deciliter using glycometer. So the next is to manage the hyperglycemia. Hyperglycemia, you manage it by, first, if she says she has a chronic disease, she has a chronic history of a past history of diabetes. So you need to measure you need to take the what you call HbA1 so that to really to be sure that she has diabetes. And if you notice that she has diabetes, you need to hospitalize the patient and give the patient insulin. But for giving insulin, you need to determine the first, is it type 1 or type 2? If you do what you call oral glucose tolerance test, and you give 70 gram of glucose in water, and you know, you see that his pancreas was distracted by autoimmune system, then it is type 1. Then type 1, it is type 1 by giving insulin. Insulin is given by subcutaneous, and insulin are of the different type. We have what we call regular, we have rapid insulin, rapid acting insulin, short acting insulin, long acting insulin, intermediate acting insulin. So all insulin which ends with R, all insulin which ends with R are called regular insulin, and all insulin which ends with log, they are called the rapid insulin. For example, rapid acting insulin, for example, insulin insulin or Humorog. And also you treat by insulin, even if you are able to treat type 1 diabetes mellitus. Also there is other type 2 diabetes mellitus, which is managed by giving antidiabetic drugs. So the role of insulin is, what is the role of insulin? We have insulin has two main free functions. Insulin take up the glucose, help the glucose take the cell. No, insulin transport the glucose into the cell, and inhibit the process of glycolysis so that the glycogen will not be break down, the glucose will not be released, and once it is in the blood there will be hyperglycemia. So it prevents hyperglycemia. So the other role of insulin is to inhibit fat breakdown. You know that when you eat too fed, for example, in the period of fasting, body tissues, when they need the glucose, they take up glucose in the blood and use it. And when you eat after meal too fed of glucose you eat pass in the liver to be stored in the form of glycogen. So when the glycogen becomes saturated with glucose, there is what we call deposit of glucose into fat. Deposit of glucose, glucose change to fats, and then they are deposited into fatty tissues, into adipose tissues. So when the liver need oxygen, need to energy again, they use fuels, and they use fats, and once they use those fats, the end product or the waste is called the ketone, and release it and pass into the blood. That is why we say those people are with diabetic ketoacidosis, because the ketone is an organic acid. So how we manage type 2 diabetes mellitus? We manage type 2 diabetes mellitus by giving what you call antidiabetic drugs and sometimes insulin. But if the type 2 antidiabetic mellitus fails, or if we need to give the adjunctive therapy. So type 2 diabetes mellitus include the alpha glucosidase inhibitors, they include the biguanides such as metformin, they include meglitinides, they include sulfoniases, which prevent the oxygen to be absorbed back in the blood, reducing hyperglycemia. That is so.